Welcome to Beyond the Press Release, a production of Agoracom, in which we take the time to speak with small cap executives after they put out important news. With us today, because it's probably the biggest news we've seen for the year in the small cap space, Andrew Morton, CEO of Maitri Health Technologies, trades on the CSE under the stock symbol MTEC, and for our friends in Europe on Frankfurt under D84. For those of you new to the story, because you might have seen this massive headline, here's what you need to know. When COVID hit about 18 months ago, there was no supply chain in place to handle this parabolic surge, immediate surge of demand for personal protective equipment, which we all now know as PPE, masks, shields, tests, all of that. And as a result, an industry of brokers, and I'm air quoting that there, spawned overnight to fill the demand of buyers who were desperate. We knew how it was, and scrambling for product. As you can imagine, that created some real issues with respect to sources and quality of supply, and many instances of outright fraud. Maitri is a global platform for healthcare supply security, whose main focus provides a reliable source and verifiable source of PPE and testing solutions through what they call an onshore manufacturing model. So this model has led to the creation of some industry-leading innovative products like 3D certified surgical masks, patent pending face shields, all the stuff you got to see, which is great. But the press release we're here to talk about today came out on July 2nd. Maitri signs definitive agreement to acquire Bloom Health for $20 million US, creating a new generation of occupational health services. Andrew, welcome back.
Hey, thanks a lot. Great to be here.
This definitive agreement signed right in between July 1st and July 4th. So you supplied all the fireworks for investors on both sides of the border. Massive deal. We know you had an LOI, but now it's, you've got the definitive. Let's talk about it, because this is an elephant, and the way to eat an elephant is in small pieces. Why Bloom? Why are they such a great acquisition?
For us, strategically, Bloom gets us, frankly, into a very interesting space. We recognized in the PPE business when we started this company last year that there were multiple industries that were really suffering from shutdowns, lockdowns, all of that. Testing became an important component of that. There have been a lot of small companies that have set up very quickly to do testing. And what we found was very few of them really were professionally run companies. It was very much a tent they pop up. It was necessary. Nobody was able to get tested. Bloom Health Partners comes really from a couple of folks that were the founders who understood Fortune 500, had incredible connections within that space, and also had a very heavy clinical background, and surrounded themselves with a really solid science and technology team. What Maitri Health Technologies announced, I'll call it, the last time we spoke, we talked a bit about a technical platform we're building. Well, now what we have is a data platform that really is now very well matched with really solid test labs. So private industry,
you got a real world, active, successful scenario, and blending that with your digital platform side to create this end-to-end company here.
Absolutely. And the acquisition comes with some healthy revenues. If you look at the transaction, you'll hear more about this later, in future announcements. But we're really excited about, how big this thing can become. But these guys have done a fantastic job up to this point of building a really solid company, and really, in about a year and a half. Their first labs were set up before the big push. This is pre-COVID announcement. They knew it was coming. They did the right things. They put a solid team around themselves, and they have a real business.
Yeah, I mean, when it's a $20 million acquisition, Andrew, this isn't just Maitri Health acquiring GeorgeCom. And we see that in the small cap world all the time. This is serious, and there've got to be some serious numbers involved. But before we get to some numbers I want to talk about, what I like here is a quote from the press release. I'm going to read it if you don't mind. This will raise the bar in health and safety as a complete digital clinical health and safety platform for Fortune 500 companies, movie studios, education, government institutions. Bloom has some Fortune 500 companies right now as clients. Are you able to talk about either specific names? And if not, are you able to give us kind of idea of what kinds of Fortune 500 companies are already being serviced?
Well, if you go to the Bloom Health Partners website, you'll see all the logos of the companies they're involved in, from tier 1 studios to Fortune 500, like you said. So, on there, you'll see PepsiCo as a client. You'll see some others as well, but there'll be more announcements about other clients go forward. And I'm reading right from their website. I mean, it's all there for everyone to see.
Sure.
So they definitely come with some large clients and a large base. What this is really building, though, and if you saw the headline, it's about occupational health. Testing really is just indicative of what big companies need. If you look at Canada, US, even Latin America, employee health and safety goes well beyond COVID. The whole concept of this is not just that we want to be a testing for COVID company, because really that really was a big concern. But if nothing, just like our PPE business, put a giant spotlight on some inadequacies in the system.
And companies really need this, right? Because up until COVID, yeah, I mean, they all had occupational health and safety and all that. But now they realize, man, we really got to be on top of this. And to do that, we need outside help. Do you think that's what the acquisition creates, the merger of these two great companies creates, that you can go into several more Fortune 500 companies, movie studios, big institutions, and say, we've got the entire platform from soup to nuts for you?
Absolutely. The near term concerns is everybody vaccinated? Is everybody safe? All of that.
Right.
But the longer term concerns are my employees healthy? And if you consider the cost of insurance, especially in the United States, to insure your employees, if you just kind of blindly let people run around and manage themselves and that kind of thing, I mean, that's what they're supposed to be able to do. The reality is your insurance premiums are going to go up and up. So how do you manage that? Occupational health is more about managing conditions proactively, and I think it also makes happier employees. I think companies will have a better chance of retaining and attracting talent, especially nowadays where all the headlines are about how do we get people to come back to work. Well, if they don't feel safe or they don't feel like going for multiple reasons, you have to put something out there. I think a 24-hour buffet, in some, tech companies was a really great idea to attract employees, because some big companies, some famous ones did that for a long time. But if you really get them where it matters in their own personal health and safety, I think that's going to make a really happy employee.
Yeah, and that's definitely something more and more employees, especially the high profile employees, right? So if you can provide these to your clients who can attract great talent, it just that's a part of the ROI that you can't even measure. Let me ask you something here, because I love reading between the lines. Clearly, now yet the press release doesn't talk about Bloom Health's revenues or EBITDA, which I have to assume are pretty healthy, again, because of the size of the acquisition price. I don't think Andrew, you and your team are in the business of giving away $20 million just because you like somebody. But the milestone payments that I saw here really gives us a view to the potential future. And all these are for the period ending December 31st, 2023. If Bloom achieves $27.5 million in EBITDA, that's one of the milestones. Another milestone was $52.5 million in EBITDA. And the last milestone is the company together achieving a market cap of over $325 million by December 31st, 2023. Man, people don't put these kind of milestones in press releases just for the sake of it. What should we all be reading into this as to how big this could become?
This is a very well thought out deal, and the runway is excellent, as you can see. We didn't put those milestones out there because we weren't thinking about some big things down the pipe. In future announcements, we'll be able to announce earnings. I'm looking forward to the next couple of quarters as things start to happen. Our merged organizations should hopefully be, all in a very quick close here, and that's the idea. I'm actually in Texas this week, spending time with the team and making sure we're putting the right pieces together. It's very exciting times, and if you look at those milestones, they didn't come blindly. We didn't just put those as arbitrary numbers. We're thinking about some big things. Testing is obviously a very healthy business. That as a standalone is not going anywhere. I think what's needed now in the testing business alone, and what makes this as interesting, is it's very much about senior relationships and and really big company buy-in, not just a retail kind of style testing facility. Because the whole concept of this is employee safety. That dovetails into bigger things, and I think the revenues and the EBITDA that you're seeing there for targets for earnouts, because you can see the Bloom team as part of earnout get some interesting milestones they get to hit personally. Like they founded a fantastic business. They're going to get the benefit of that, but at the same time, you can see where the runway is.
You haven't been able to give us the numbers just yet. When do you think we'll see the first Bloom numbers? Will that be coming in future press releases, or are you going to wait until the first full quarter, for example, when we finally start to get an idea of that?
Well, we really are pushing for a speedy close if we can. And here in July, we're now in July, and we just got to get on with business. The LOI was announced a solid 6 weeks ago. So as you can imagine, we've been thinking a lot about this. I've done all the legwork has been really done the last 6 weeks or so. Well, I'm looking very much forward to announcing our final close, very soon, this month. And then from there, then we'll look at the periods and when it makes sense to start announcing real earnings and revenue and all of that. But very excited to do that. To me, this is really about a solid business that we're putting together.
And last question on this part, which is in order to get to those potential milestones, $27.5 million in EBITDA, $52.5 million in EBITDA, that's going to require a sales force, some real market execution. How are you guys going to go to market? Do you just follow Bloom Health's sales and marketing team, or do you now have to bring in the Maitri team or a combined bigger team? Because obviously this is a new solution. You can go to market. Talk to us about how you start to generate those sales. How do you get to George Com Studios, or how do you get to George Com, the Fortune 500 company, in order to hopefully get to those milestones?
Well, Bloom comes with some fantastic relationships and a very capable team. Business development, it's been very good. And we certainly didn't, the numbers you're seeing, the acquisition cost alone, it didn't come blindly. There's some real stuff behind this business. That being said, the combined teams, we're going to build a real powerful senior leadership team. And that's really a result of myself, the Maitri team, the people at Bloom, but then we're of course around that core team, as we define our strategy, which is what we're doing right now. Well, then we start adding the right resources to really hit all four corners, and all four corners being, healthcare, really as a service. Obviously testing is a big thing, but there's a whole digital component of this. And then of course our PPE business, that doesn't go away. That's still really important, but it really becomes part of this bundled package that an organization can now buy and say, okay, well, now I have a total safety program.
Let's move on. I'd love to ask you more questions about the deal, but I'm not going to be able to you've given some great info, but obviously there's going to be, more to come. Beyond Bloom Health, I think it's important to talk about, you also complete agreement with ScyllaDB. That's going to enable you to quickly scale up your cloud-based health tech platform for large corporate and government clients. Was that done in anticipation of the deal of the acquisition of Bloom? And what should investors know about how important that is?
Well, that was independent of the Bloom acquisition, but it does really build a solid foundation for our data platform. So really, as an organization, as a health tech, it really is about data and our platform and managing outcomes. All along, health and safety was an important thing to us because that's really what we founded the business on. As we started dealing with corporate clients and some of the studios ourselves for our PPE business months and months ago, we recognized right away where there is a giant gap in the market. And there was a real lack of sophistication around health and safety. And the big challenge now,
that's surprising, really.
It's striking to me, and I think it's really, not to anybody's fault. Companies just didn't have to think about this before. A safety program in a company before all of this was, you had an EMT, an emergency team on site.
Right. Don't slip and fall. Make sure people don't trip over stuff on the floor. That's what it really was beforehand, right?
That's exactly right. They basically were taping up skin knees. That's that's the equivalent of what they were doing before. If it's an amusement park, it's the same thing, right? Same idea. You're dealing with guests, right? Which is, an important part of the business, but that isn't really health. That's just safety. Very different. Now our big concerns are that, as thankfully we have vaccines, which is fantastic. How do you know who's been vaccinated, who hasn't? How do you deal with all those kinds of things? And then how do you have a data platform to understand what the risks are as you run forward? So the Scylla announcement is really about building a true big data backend to make this work. There are many, really too many sort of two-dimensional kind of health apps that kind of popped up as a result of the pandemic that we're just getting through. Okay. They don't really do big data management. And that's really what we're about, is big data management. Because once we do that, and Scylla, our selection for them was an obvious one to us because they're already doing big data for Comcast, for AT&T, some big players, and they handle big data. So they understand the complexities of how to do that. And what we needed really was a platform to build ourselves on top of.
Andrew, is it safe to say that we are seeing the creation of a brand new industry? No, you can't say brand new because health and safety has always been there, but the morphing, the parabolic growth of an industry that's gone from, like you said, patching up skin knees, make sure people don't trip and fall on the floor and things like that, into full-blown, occupational health services. And if so, how big do you think this new paradigm shift is going to be? In other words, what's going to be the size of the market that you guys are going to be able to go after? And does this make you one of the early leaders?
Okay, so the short answer to that is this is definitely a new industry. I think the more expanded side of that is that organizations, for the first time ever, recognize, well, if nothing, the pandemic showed them how much of a need there was for this. But the go forward is, if you want to have employees feel safe just to be at work full time, you have to have some kind of safety program and a health program. Longer term, if you keep your employees healthier longer, well, then you don't have to replace them, because what's the cost of replacing an employee? So this really definitely is that new frontier, I would say. Now, we're not the first to have occupational health, because there's some of that already happening.
Of course.
But what we do bring to the table is now a lot of intelligence around data and data management. So now they can do some serious planning and risk assessment. Before all this happened, really a lot of insurance companies were kind of running blind to what the health condition was of the big packages that they underwrote for big companies. That's all real. They didn't fully understand. Their actuaries really had very little data. We can provide more data. Well, premiums go down and employees, they last longer. To me, that's a win-win for everybody.
Last question on this. It feels like the industry is going through what the mobile phone industry went through 15, 18 years ago, which is, yeah, you're right. You guys aren't the first. There've been other people there, but up until now, the mobile phones are just phones to make a phone call and maybe get a text. And then they went parabolic once data came in and apps, and they became a completely different animal, and they exploded in terms of the valuation and of the industry. Is that what's going on the occupational health side now?
This is a paradigm shift in health, because now individuals for the first time are aware of their own health. This is the first time ever. Well, I wouldn't say ever. 100 years ago it happened when we had the last pandemic. If nothing, the last year showed individuals they have to take control of their own safety and health. And then there's always that concern now. So that's that part of it. But long term, this is absolutely a paradigm shift in how organizations are going to run their massive employee base. How do you keep everybody healthy, and how do you know before something happens what to do? What's your proactive measures? Data will show you that. I hate to use the term AI because it's a little bit overused, but artificial intelligence, is really about predictive and machine learning, and machines actually writing more code.
That's where health is going.
Without question. Because if we don't throw some intelligence at it, then we're never going to get there. That's the way our vaccines got here so quickly. Without question, without technology, the vaccines wouldn't be right now in me. I've had my second shot already, and that wouldn't have happened, 100 years ago. No way, because we didn't have that data management to do this. So why wouldn't we manage populations the same way? We can be better at this long term, and it's not about pandemics. It's more about long-term health outcomes. Diabetes.
There's no doubt. There's no doubt. And can you even quantify as a result? You're right. Maitri wants its employee George to be healthier. First of all, you want a better employee who's healthier, happier. At the same time, you want to keep your costs under control for what it costs to pay for my insurance and all those things. So now we're seeing the morphing and this parabolic growth. Have you guys even been able to quantify where you think, or is it just going to be so damn big that you don't need to worry about it? You just need to go out there and execute, sale, build the platforms, soup to nuts from Bloom to Maitri, and you got this fully integrated platform, and just go win, because it's that big. You don't need to thread a needle.
It's a giant market, and the reason why is because now everybody's recognizing that this is the next frontier. This is what they have to do to run a sustainable business. What is the surety our business is going to run? Data will tell us that. What about in the future? How do you manage things like diabetes, which is an entire pandemic of its own? Really, it really is an epidemic. The diabetes by itself, type 2 onset diabetes, is a major situation where you've got really literally millions and millions of people. Something like, I think the last number I read was something like 20% of the United States is potentially type 2 diabetic, which is a very large
obesity, right? A lot of that's got to do with obesity, not being healthy, not being proactive.
That's right. So if you can manage that alone, well, consider this, your employees are more productive. They're going to be more energetic, which is also positive. But more than that, as a business owner, it's going to cost you less. So, consider, a modest amount per employee you spend per month, per year, and, some kind of SaaS platform, which is what we're doing. You layer that with some health services around what we're doing with Bloom. Well, now you have a really, really safe bet that more and more of your employees are going to be there for the next 5 to 10 years. Your business is going to run Here's predictability of revenues, and my costs to do things like liability insurance and that kind of thing. Those start to change. Healthcare insurance starts to change. And if some other, God forbid, pandemic happens 5-10 years from now, we're already prepared for it.
Yep. You got less churn, right? And another, the invaluable X factor is George feels so good about what Maitri is doing to help contribute to his health, that he's just putting that much more passion and effort. I don't care what you tell me, just putting that much more passion, effort, and time into the company because you're just so happy to be a part of it. So the ROI is just limitless. And I can't wait till you're back on, Andrew. And sounds like there's going to be more to come out of this in short order. So can't wait to have you back and keep talking about this. But I think we're seeing the birth of a massive parabolic growth industry, and Maitri sliding right into that for the next decade. Forget about the next 6 or 12 months, just for the next decade.
Absolutely. There's a lot more to come. Very excited to talk about it. In the meantime, you absolutely captured it. The next 10, 20 years at least, because right now, all organizations are trying to figure out, how do we maintain long-term operations? How do we have predictability in our model? They've never had that before. Now we're between the data platform we built, and then also now with the clinical labs with Bloom Health, we now have a winning combination.
Well, congratulations on signing the definitive agreement. We'll wait for the close to officially happen. That's going to happen here in July, and I don't think it's going to take very long. And then the great, unveiling it like an onion, just peeling it back layer by layer, getting to know more about the combined company. But thanks for joining us, Andrew, and congratulations.
Thank you.
For everybody at home, you've been watching or you've been listening by podcast on Spotify, Google, Apple, your favorite podcast platform, to Andrew Morton. He's CEO of Maitri Health Technologies, trades on the CSC under MTEC, and for our friends in Europe under D84. You've heard or you've watched what he's had to say. You got to do your due diligence now, guys. So make sure you get to the Maitri profile and Agoracom, because we know there's a lot. It's a brand new industry, brand new vertical here, almost, or at least it's morphing into one. So start your due diligence there to get that good 10,000 foot overview. And then from Agoracom, or you see it right over Andrew there, go to maitrihealth.ca, do your deep dive due diligence, because there's no doubt about that occupational health is going to go through a major transformation. New winners are going to be born. New winners are going to be created, and you got to find out for yourself. We can't tell you. You got to do your due diligence. How Maitri is going to participate in that new industry. Hopefully, you discovered your next great small cap company. Thanks for joining us. Have a great day. See you next time. Hey guys, this video is over, but don't forget to help your company by liking it and then leaving a comment below. And then don't forget to help yourself by subscribing to our channel so you don't ever miss another great Agoracom small cap video.